Hi everybody. We are here to speak regarding the ovarian carcinoma, especially the recurrence ovarian carcinoma. I myself, Dr. Thusam James, fellows in the Gynaecology Onco department. With us is our consultant, Dr. Rohit Ranade. Uh, Welcome, sir.
Welcome. Thank you, James.
Regarding this, there are certain questions which has been specially asked by the patients and patient parties, and they want to know about the condition of the recurrence ovarian carcinoma. These are some common questions which everybody wants to know about the thing. So first of all, the thing which they want to know is like, sir, what are the roles of ovaries in our human bodies, sir?
Okay. So basically, see, ovaries are unique organs. So they are located on the side of the uterus in a normal female body. So the main function of the ovaries is to produce hormones, which is estrogen and progesterone. Now, estrogen and progesterone, they have various functions in the body. They are responsible for protecting the bone health. They are responsible for maintaining the blood supply of the skin. Plus, estrogen and progesterone are responsible for maintaining a menstrual cycle. Now, in addition to that, the ovaries also produce something called, in layman terms, called as the egg. Now, the egg is responsible for the production of a baby. So, this is the main function that ovaries do in our body. So, they secrete hormones plus they produce egg as well.
Okay, so the next question is like, how likely is it for ovarian carcinoma to come back, sir?
Yes, that's a very valid point. I mean, for somebody who walks into your clinic with an ovarian cancer and has finished treatment, the first question would be, Doctor, will it come back? So, primarily, it depends upon multiple factors. First and all, the stage at which the primary presentation is most important. Higher the stage, like advance the stage, more is the chance that it can come back. Also, disease biology is very important. Now, biology means, in layman terms, it means how aggressive is the tumor and how sensitive is the tumor to standard treatments. So, if the biology is bad, it means that it can come back.
Okay.
Another important point is whether the treatment was done properly. That is, whether the surgery was done properly. Now, proper surgery means that all the disease has been removed. Or it was wherever it is known as, in medical terms, it is known as gross macroscopic resection. Plus, in addition to that, whether chemotherapy, if required, was given or not.
Okay, sir. So, and then the most common question which they ask is like, what do you mean by the recurrence ovarian carcinoma?
Yes. So now recurrence is a medical term. Recurrence means somebody who has taken treatment for the cancer, has completed treatment, and has been disease free, like she has been free of the disease for some time, and then unfortunately, due to certain reasons, the cancer comes back. So that is called as recurrence.
Okay, sir. Usually, how is the recurrence ovarian carcinoma has been detected, and where does it usually occurs if it recurs also, sir?
So in that view, see, ovarian cancer is a very unique disease. It's like it's one of the cancers where the presentation can be very heterogeneous. That is, it can have disease in the entire abdomen. They can also have metastasis at different organs. So per se, patients can present in multiple ways. They can present either a disease in the liver, in the lungs, or in the abdomen. But primarily, majority of the patients will come back with a disease in the abdomen called as a peritoneal recurrence.
Okay, sir. Is there any prevention of like way to prevent the recurrent carcinoma? Is there any way for the like any method or anything is there to prevent the recurrence of the carcinoma which was treated with the proper treatment earlier and all those things, sir?
Yeah, so as of now, whatever research we have, there is no evidence by which we can do something to which the cancer can be prevented from coming back. So the only thing what is in our hands is proper surveillance. So that is why when somebody has completed treatment, it's important that a regular follow-up is maintained. Like for the first 2 years, every 3 monthly checkups are most important. Now, there are some things in only small subset of population where somebody has a mutation to a gene called as BRCA mutated. So in those individuals, there is a role of taking a tablet known as PARP inhibitors, where if you can take the tablet, it is known that the cancer, there is some role to suggest that recurrence can be prevented. So, but only in that population. In the general population, we don't have any evidence.
Okay, so what will be the sign and symptoms of the recurrent ovarian carcinoma?
Yeah, so this is also something which is unique, because as you know that primarily ovarian cancer, the symptoms are very heterogeneous. So similarly in recurrence, the symptoms are very non-specific. Like somebody can present with increase in the abdominal size, somebody can present with vomiting if there is deposits on the intestine. Patients can present with sometimes with pervaginal bleeding if there is a deposit in the vaginal area which is come. Or sometimes if there is some deposits in the lungs or the liver, patients can present with difficulty in breathing. If there is accumulation of fluid in the chest, patients again can present with difficulty in breathing. Sometimes they can present with, if there are deposits in the liver, they can present with elevated jaundice or yellowing of the eyes. So that could be the presentation.
Okay, sir. So what will be the treatment for the recurrent ovarian carcinoma? It's going to be the surgical, or it's like the chemotherapy only, or how is it like?
Yes.
Depends.
So there are various aspects of that you have to consider before you offer treatment to the patient. Now, it is most important that to know something called as platinum free interval. That is, from the last chemotherapy, after how much time has the disease come back. Also, what is most important is where is the disease, at how many sites. Another thing which is most important is how is the performance status of the patient. If the patient is fit enough, she's walking, she's minimally symptomatic, that would be a favorable candidate for surgery. Also, if the disease is at single site, then there is evidence that you have to go in for surgery. Also, if the fluid in the abdomen is less than 500, there are more chances that the patient will benefit with surgery. So in these cases, surgery should be considered. Otherwise, the patient should be considered for chemotherapy.
Okay, sir. And like during the surveillance times after the treatment and everything, if sometimes the patient think that like if there is a rash on CA125 only and the other thing is not there, will you be considered as a recurrence, or how it's going to be follow up like that, sir?
Yes. So see, majority of the patients of CA of ovarian cancer, they already have a elevated CA125. So as a follow-up, we ask them to do a CA125 every 3 monthly. But sometimes what you see is only the CA125 will be elevated, but the patient is not symptomatic. It doesn't have any symptoms. And if you do some test like a CT scan or a PET scan, there is no disease which is detected. So this is not an indication for treatment. In those patients, we don't advocate treatment, but we just advocate follow-up.
Okay, sir. So is there any role of any maintenance therapy or something in the ovarian carcinoma, sir?
Yes. So maintenance therapy, I was talking about the PARP inhibitor. So only as of now, what evidence we have is only in those patients where there is a BRCA 1 and 2 mutation. So that is why it is very important that all high-grade serous cancers, which is the commonest type of ovarian cancers, all young cancers, one should go in for BRCA testing. And this BRCA testing nowadays should be done in the blood, as well as it should be done in the tumor tissue which is resected. Okay. In those individuals where there is a BRCA mutation present, definitely maintenance treatment with PARP inhibitors has known to have a significant survival advantage.
Okay, sir. Is there any role of targeted therapy, sir, in the recurrence ovarian carcinoma, sir?
Yes. So basically, the PARP inhibitors is one of the targeted therapy. In addition to that, there is a common drug which is used is bevacizumab. So in certain situations, the use of bevacizumab does have an advantage, especially if the patient is presenting with recurrent ascites, that is recurrent fluid in the abdomen or recurrent fluid in the chest. Okay. In those situations, bevacizumab has known to have a added advantage, but most of the times the treatment is only with the standard chemotherapy.
Okay, sir. The last question is like, what are the role of genetic testing in the ovarian carcinoma?
Yes. So that is what I was saying. So now previously, see, we used to think that only about 20% of cases of ovarian cancer are because of genetic mutation. But now as more and more studies are being done and more science has progressed, it is believed that at least now 38 to 40% of ovarian cancers might have some genetic role.
Okay.
So they might be germline, which is like transmitted from from your mother to the daughter, or they might be sporadic, that is occurring in the individuals itself. So that is why in ovarian cancers, especially in the high grade serous ovarian cancer, and as I said, in young cancers, patient who present with young cancers, genetic testing should definitely be advocated.
Okay, sir. Thank you, sir. Hopefully, everybody's some of the doubt and the questions which were queried by the this one audience will be clarified by our consultant. And thank you.
Thank you.